Switching gears to this, the Trump administration is cutting off all federal taxpayer dollars for transgender surgeries and treatments for minors. A new rule blocking federal Medicaid and children's health insurance program funding for paying for puberty blockers, hormone treatments, and surgeries for, say, adolescents and children.
The president's saying, quote, "We are not going to pay for our innocent children to undergo these barbaric surgeries and practices," adding, quote, "While the Democrat Party wants your kids to be able to chop off their reproductive organs before they're old enough to vote, President Donald J. Trump, me, and the Republican Party say that is absurd." Well, joining us now is Dr. Eithan Haim, who blew the whistle on transgender care happening at Texas Children's Hospital. Doctor, very good to see you today, especially on this, I would say, fairly momentous news. I'd love for you to talk to the audience about how big of a difference this will make that Medicaid can no longer pay for these kinds of surgeries on kids.
So, yeah, thank you for having me on. I mean, it's a fortuitous time, especially with everything that's happening with CMS, but then also the Texas Children's Hospital healthcare fraud settlement. But specifically about this rule, this is a really big deal because there are some estimates, the Kaiser Family Foundation, for example, estimates that there are 270,000 children in the United States that believe they're transgender and are also covered by Medicaid. So that number, that's a huge number. We're talking about over 200,000 kids. So with this rule change, which goes into effect October 13th, the federal government will no longer match funds from the state. This will place the burden fully on the state to pay for these interventions. So it's a good thing that taxpayers in Texas won't be paying to trans kids in California. That's great. But these things are still going to happen. These blue states that are doing it are just going to shift around this money. Likely, are they going to comply? And that's one of the things that Dr. Oz is going to have to deal with, because if there is one thing that these people have proven themselves, it's they are very dedicated to criminality. They have no qualms about breaking the law and deceiving the federal government in order to carry out their ideological framework.
And the ideological framework involves ensuring that there is money for the chemical castration of children and for the sterilization of children who have what is a psychological disorder, say gender dysphoria, Dr. Haim. And just reading some of the mainstream coverage, and not even the New York Times has a very straightforward headline: Trump administration bars Medicaid funding of transition treatment for transgender youth. But if you go over to, say, a CNBC, the headline is gender-affirming care for children, funding is ended. And it refers to Republicans are trying to limit health care for transgender children. Talk about how dangerous that kind of language is.
Well, I mean, all these words, all these phrases are euphemisms for the sterilization of confused young children. And I would say that it's the same thing in adults. The entire edifice of this medical practice was completely fabricated. It's based on ideology. The people who developed it were most of them were pedophiles. They're grifters, they're fraudsters, and they're liars, they're butchers, and they should be nowhere near your children. Despite the gravity of this situation, you have mainstream institutions in this country who are still supporting it. So, this rule change is a good thing. I believe that the government should go further to limit funding to hospitals who participate in this kind of medical interventions.
Right.
Dr. Eithan Haim, you've been on the front lines in this. We are very glad to talk to you always about these issues. Thank you very much.
Thank you, sir.